So prevalence for suicide right now between the ages of 10 to 34 years of age is the second leading cause of death. In children in general is the second leading cause of death. And if you look at the ages spanning throughout the lifetime, it has always been a top 10 leading cause of death. Number one use is firearms. So risk factors, there's a lot. Any of them being recent changes, death in the family. The biggest risk factor though is if there's actually been a suicide attempt by the patient or by the patient's family. And so that's the biggest risk factor. Other risk factors being if they're suffering from any sort of mental illness, chronic diseases, chronic pain. So most people, they think if you ask the question about suicide, that it's going to increase the risk for suicide. But the studies have shown just asking the patient, hey, do you have any thoughts on wanting to hurt or kill yourself? Just simple like that allows you to get a lot of people to tell you, yes, I am. Because it shows that you're concerned for the patient. And so when the patient feels that they're concerned, it's like, well, I do actually have these thoughts. And so they've noticed that it increases the people being more honest with you and actually answering, versus the contrary thought that most people think of, okay, this is not going to actually help me at all. Chronic suicidality is actually just a generalized term. We don't have a definite definition of it. It's something that is being considered to be put into future renditions of the DSM. Currently in the DSM-5, there's no actual diagnosis of chronic suicidality. Now, you'll hear people talk about someone being chronically suicidal, and so it could be 6 months, could be a year, but the idea is they have these thoughts all the time going in thetheir mind, or majority of the time than not, of suicidality. Because the treatment for chronic suicidality, even though we don't have a diagnosis for it, it's when somebody, they have these thoughts all the time. If you're ever concerned, please, it's better safe than sorry. Send the patient to inpatient or call for psychiatry to consult to see the patient. But the main therapy, its mainstay treatment is going to be therapy. It's not going to be some magical medication and everything. Yes, for psychotic patients, clozapine has shown to reduce the risk for suicide attempts and suicidal ideation, and for some bipolar patients and everything, lithium. But chronic suicidality treatment is still going to be therapy. So the CDC has published these 5 tips and everything for suicidality. Ask someone if you're worried about them, if they're thinking about suicide. While people may hesitate to ask, again, as we discussed, research has shown that it's been helpful to ask. Keep them safe. Reduce access to lethal means for those at risk. Like I said before, firearm safety. Hide the knives, hide the sharps, put the pills in locked containers. So number 3, be there for them, or be there with them. Listen to them, what they need. They may talk it out with you and in the end feel a lot better, kind of therapeutic. Again, if there's an acute need, please send them to the hospital or talk with psychiatry and get their recommendations if they're in the clinic or in another healthcare manner. Number 4, help them connect with ongoing support. Again, therapy. Help them with their therapy. And number 5, stay connected. Follow up to see how they're doing. And that, again, comes down to the asking them questions, seeing how they're doing, seeing how they're reacting to treatment, therapy, and things like that. So some resources that are available is to go onto the APA website, the ACAP website, Google search suicide resources, and these are the resources that I have available here in these slides. The only extra thing I would bring up and everything is for the LGBTQ plus community, there's the Trevor Project, and so they have their own suicide hotline as well that they can text and call. Most of the suicide hotlines and everything, there's a special VA one as well. They allow text, they allow calls, and so you have the option of communicating however well you need.